Still finding blackheads the day after a deep clean? If you've tried harsh scrubs and painful pore strips only to see them return, you're not alone. The truth is, many common methods can be too aggressive, leading to irritation and even more breakouts. True, lasting clarity doesn't come from force. It comes from a smart, gentle sequence that respects your skin's natural barrier. Today, we'll walk through a professional-grade, at-home facial that works with your skin to melt stubborn clogs, lift them safely, and lock in clarity for good. Before we begin, always patch test new products. Apply a small amount behind your ear and wait 24 hours to ensure it's right for you. Our first step is to soften. For 3 to 5 minutes, apply a warm, damp towel to congested areas, or lean over a bowl of warm steam. This gentle warmth softens the hardened sebum and keratin plugs that form blackheads, making what follows significantly more effective. Think of it as preparing the canvas. For a therapeutic boost, add a green tea bag for its powerful antioxidants, or a single drop of tea tree oil for its natural antibacterial properties. After, gently pat your skin dry with a clean towel. Now, the 60-60 double cleanse. This two-step method is the cornerstone of deep pore clearing. First, massage a cleansing oil onto dry skin for a full 60 seconds. The oil acts like a magnet for the oil-based impurities in your pores, including makeup, sunscreen, and sebum. Focus on the nose, chin, and other congested areas. Add lukewarm water to emulsify the oil into a milky texture, then rinse thoroughly. Next, use a gentle gel or foam cleanser for another 60 seconds. Look for salicylic acid to exfoliate inside the pore, or soothing heart leaf for sensitive skin. This second cleanse sweeps the pores clean of any remaining residue, without stripping your skin's protective barrier. How does your skin feel? If it feels tight, dry, or squeaky, your cleanser is too harsh and is stripping away essential lipids. Healthy, properly cleansed skin feels comfortable, hydrated, and balanced. Now we exfoliate with purpose. For blackhead-prone zones like the nose and chin, a BHA toner with 0.5% to 1% salicylic acid is your best tool, used 2 to 4 times per week at night. Gently press it into the skin with your fingers or a soft pad. BHA is oil-soluble, meaning it can penetrate deep into the pore lining to dissolve clogs from within. For more sensitive areas or for a gentler all-over exfoliation, opt for PHAs, LHAs, or lactic acid 1 to 3 times per week. They have a larger molecular size and work on the surface with minimal irritation. A crucial rule: always skip exfoliating acids on nights you use a retinoid to avoid over-exfoliation and irritation. And it's time to retire the gritty physical scrubs. They can create micro tears in the skin, leading to more inflammation and potential damage. For a weekly reset, use an enzyme and clay mask. Mix kaolin or bentonite clay with a pinch of papaya or pineapple enzymes. These enzymes gently dissolve dead skin cells on the surface. Activate with brewed green tea, apply a thin layer, and rinse after 8 to 10 minutes, just before it feels tight and fully dry. For individual pimples, follow the hydrocolloid rule. If a whitehead has visibly surfaced, apply a patch to clean, dry skin overnight. It creates a moist, protected environment and gently draws out fluid and pus. If the patch turns white, it's done its job. For deep, painful bumps that haven't surfaced, an ice compress for 60 to 90 seconds can be a game changer. The cold helps constrict blood vessels, helping to deflate swelling and reduce pain without irritating the lesion. Let's talk spot treatment logic. For an inflamed whitehead, a 2.5% benzoyl peroxide spot treatment at night is highly effective at killing acne-causing bacteria. If your skin is sensitive or easily irritated by benzoyl peroxide, sulfur is a gentler, anti-inflammatory alternative. For areas with clusters of clogs or frequent breakouts, shift from a spot treatment to an area veil. Apply a thin layer of an azelaic or salicylic acid product over the entire congested zone to treat existing spots and prevent new ones from forming. If you must perform an extraction, do it with extreme care and only on softened blackheads after a steam or mask. Sanitize your tool or wrap your fingers in tissue. Place the tool beside the pore and apply gentle, rocking pressure to lift the clog out. Follow the rule of twos. If it doesn't lift in 2 light attempts, stop. Forcing it causes trauma, scarring, and inflammation. Afterward, immediately swipe the area with BHA and use an ice roller to calm redness. After any treatment, especially exfoliation or extraction, soothe your skin. A hydrating toner or mist with calming ingredients like Centella asiatica, heartleaf, or panthenol will immediately cool redness, reduce inflammation, and begin to replenish your barrier. Now, treat your skin. For oily, congested skin, choose a serum with 4 to 5% niacinamide. This powerhouse ingredient helps regulate oil production, minimize the appearance of pores, and strengthen your skin barrier. If your primary concerns are redness and the dark marks left behind by breakouts, a thin layer of azelaic acid will clarify pores while also evening out skin tone. Finally, seal everything in with a lightweight, non-comedogenic gel moisturizer. Look for ingredients like hyaluronic acid for hydration and ceramides to support your skin barrier. This final step prevents water loss and rebound oil production, keeping your skin balanced. Let's map this out into a consistent routine. Your morning routine is simple: a gentle cleanse, a soothing toner, your chosen treatment serum, a lightweight moisturizer, and always a non-comedogenic sunscreen of SPF 30 or higher to protect your skin. Your evening routine starts with your 60-60 double cleanse. On treatment nights, apply your BHA toner. On alternate nights, use your retinoid. Always finish with your moisturizer to lock in hydration. A critical safety rule: never stack a retinoid, strong exfoliating acids, and benzoyl peroxide in the same routine. This combination is a recipe for a compromised skin barrier. Alternate them on different nights to get the benefits of each without the damage. Don't forget that small lifestyle habits make a big impact. Change your pillowcase every few days to avoid transferring oils and bacteria back to your skin. Wipe your phone daily. Cleanse your face after workouts. Clean your makeup brushes weekly. And as much as possible, keep your hands off your face. Be patient and consistent. Within 48 hours, you should notice calmer, less inflamed skin. After 7 to 10 days, your skin will feel smoother as surface congestion clears. By the 4-week mark, you will see a visible reduction in the blackhead cycle as your pores remain consistently clear. Let's do a quick recap of our deep cleansing ritual. First, we soften the skin with gentle steam. Then, we perform the 60-60 double cleanse. Next, we use targeted exfoliating acids. For active breakouts, we use spot treatments or hydrocolloid patches. After any treatment, we soothe the skin, apply a serum, and finally, seal everything in with a moisturizer. A couple of common questions. Is it purging or irritation? Purging is a temporary increase in breakouts in your usual spots as actives clear out pores. It lasts 2 to 6 weeks. Irritation is immediate redness, stinging, or breakouts in new areas, a sign to reduce frequency or stop. And can you extract daily? Absolutely not. Limit extractions to once a week at most, only on fully softened clogs, and stop if there's any resistance. Remember, your first line of defense is always a consistent, gentle routine. Drop a emoji in the comments if you're ready to start this routine. If this guide was helpful, please like and subscribe for more barrier-safe methods that deliver lasting results.